Tuberculosis, also known as TB, is a highly infectious sickness that affects the lungs. It has the potential to spread to other regions of your body, including the brain and spine. A type of bacteria called Mycobacterium tuberculosis causes it. TB was a prominent cause of mortality in the United States during the 20th century. Antibiotics are now used to treat the majority of cases. It does, however, take a long time. Medication must be used for at least 6 to 9 months. A TB infection doesn't always mean you'll get sick. There are 2 forms of the disease. If you have latent tuberculosis, the bacteria are present in your body, but your immune system prevents them from spreading. You're not contagious and don't have any symptoms. However, the virus is still alive and might resurface at any time. If you're at high risk for reactivation, such as if you have HIV, have had an infection in the last 2 years, have an abnormal chest X-ray, or have a compromised immune system, your doctor will prescribe drugs to prevent active TB. The bacteria grow and cause you to become ill. You have the ability to transfer the disease to others. In adults, 90% of active cases are caused by a latent tuberculosis infection. Latent TB doesn't have symptoms. A skin or blood test can tell if you have it. Signs of active TB disease include a cough that lasts more than 3 weeks, chest pain, coughing up blood, feeling tired all the time, night sweats, chills, fever, loss of appetite, weight loss. You could be more likely to get TB if a friend, coworker, or family member has active TB. You live in or have traveled to an area where TB is common, like Russia, Africa, Eastern Europe, Asia, Latin America, and the Caribbean. You're part of a group in which TB is more likely to spread, or you work or live with someone who is. This includes homeless people, people who have HIV, people in jail or prison, and people who inject drugs into their veins. You work or live in a hospital or nursing home. You're a healthcare worker for patients at high risk of TB. You're a smoker. A healthy immune system fights the TB bacteria. But you might not be able to fend off active TB disease if you have HIV or AIDS, diabetes, severe kidney disease, head and neck cancers, cancer treatments such as chemotherapy, low body weight and poor nutrition, medications for organ transplants. When someone with tuberculosis coughs, sneezes, talks, laughs, or sings, small droplets containing the bacteria are released. You can catch it if you breathe in these microorganisms. It's not easy to get tuberculosis. You normally have to be around someone who has a lot of germs in their lungs for a long time. Coworkers, friends, and family members are the most likely sources of infection. Germs that cause tuberculosis do not survive on surfaces. You can't catch it through shaking hands or exchanging food or drink with someone who has it. Your therapy will be determined by the nature of your infection. If you have latent tuberculosis, your doctor will prescribe antibiotics to destroy the germs and prevent the infection from becoming active. Isoniazid, rifapentine, or rifampin may be given alone or in combination. You may need to take the medication for up to 9 months. Call your doctor straight away if you see any indications of active tuberculosis. Active tuberculosis is also treated with a mix of medications. Ethambutol, isoniazid, pyrazinamide, and rifampin are the most prevalent. You'll be taking them for 6 to 12 months. If you have drug-resistant tuberculosis, your doctor may prescribe 1 or more medications. You may have to take them for a longer period of time, up to 30 months, and you may experience greater adverse effects. To help stop the spread of TB, if you have a latent infection, take all of your medications so it doesn't become active and contagious. If you have active TB, limit your contact with other people. Cover your mouth when you laugh, sneeze, or cough. Wear a surgical mask when you're around other people during the first weeks of treatment. If you're traveling to a place where TB is common, avoid spending a lot of time in crowded places with sick people. So, have you learned anything about tuberculosis? What are your thoughts about this video? Comment down below.